Hello everyone. Today we have Dr. Amit Raj with us. Dr. Amit Raj has done several things in the world of cardiac care and is himself a cardiologist. So, how are you, sir, today?
I'm good, thank you. How are you doing?
Hi, I'm doing great too. Since you are in sitting next to me, I'll be doing great, even better now.
It's all in the mind. It's all.
A doctor is sitting next to you. You are always rest assured that nothing bad will happen to you.
Well, I mean, thanks, but it's all on individuals, mindset. Yes.
That could be one belief, but my belief is set to be this.
So, thank you.
Sure. Since I am with the most famous cardiologist in India, I'd start with some questions that would definitely be very, very helpful for people out there. So, starting with the digital health questions, first of all, I would like to ask you, sir, since you have done so much into technology, so much into clinical, so much into diagnostics as well. So, what do you think is the most disruptive technology that healthcare is yet to encounter in the future?
See, I'll just add on to what you have said.
Mhm.
See, technology is a ever evolving, domain,
Mhm.
and healthcare has been supported with the advancement in technology.
Right.
So, I feel there's nothing as such called, the best technology or the best, tech or so I feel is the most important part is on a disruptive collaboration on technology front to enhance, patient-centric, patient focus and, helping the doctors,
Mhm.
do their, healthcare delivery more efficiently and more effectively. So, day by day we see new tech, day by day we see new startups.
Mhm.
So how we collaborate together
Right.
in making the healthcare system more efficient, in terms of, patient care is something need of the hour.
Right.
So technology, India is a huge population, and we see India is going to be the, one among the top two or top three nations in developed countries in the next about 20 years. I mean, we'll be even more better than what the other developed countries are.
Right.
But with data, with population and data, we see a huge opportunity for, health tech companies
Right.
to come and innovate with this healthcare data which this country has, and how this can effectively be utilized, collaborated to the betterment of the people of this nation.
Right. 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 So, sir, since you were talking about patient centricity and patient safety primarily, so India is a country where the doctor to patient ratio is miserable. Right. So, how are we thinking to cope up with that thing in the future?
Well, you're right on the doctor-patient ratio on the
Right.
population. Well, I mean, we did fairly very good in COVID,
Right. We did.
which we did, and the entire nation was, affected with this pandemic.
Mhm.
But doctors, paramedic, and the support team with local administrators have stood up in the need of the hour, and this has shown to the world that yes, in spite of being, short of doctors or short of paramedic staff, we could easily and, efficiently manage this pandemic without causing much of, disturbances,
Right.
both, physically and as well as financially and economic wise. So, yes, we doctors are more efficient because we see many variety of patients. I mean, we are, we if you go to the, tier 2, tier 3 city where a GP or a physician sees at least about 150 to 200 OPDs per day.
Right.
So definitely is the commitment. It's the, the the passion about being a doctor. Well, in India we could see that,
Mhm.
but we need to improve the doctor-patient the ratios. More doctors need to be, trained first of all, and to be exposed to all kind of, disease management,
Right.
and then how, they can apply, the their studies on patient-centric approach, and then build up the, the trust which has to be, really, adding on as days goes.
Right, right. So since you're talking about building up trust, it has been done greatly in COVID,
Yeah.
right? India has been patted by many developed nations, and everyone was like just encouraging us, just telling us what we did best. Even like I read a report wherein people were saying that India is a country with so big population that even 10 years would be less to administer vaccines, right? Which was easily done in 2 years. At the end, we have like even the booster doses gone off.
Well, I mean, it's all how efficiently the top leadership and how that that passion has come down to the last healthcare worker and collaborators to enforce this vaccination program on a large scale, which is very phenomenal, which is really appreciable. And foreign media do appreciate this, that this has been done efficiently. And healthcare. Well, I mean, India was a pioneer in the entire global health. I mean, you can see that from Ayush and from our history speaks. So India is a country of globals.
Right.
Yeah, it is just that we face the pandemic or we face any kind of a problem, then we stand up together.
Right. And since you're the visionary behind the Plexus Cardiac Care, I would like to question about the NCDs, the non-communicable diseases. Like, how are we thinking to get them with the word digital health? Is it helping anywhere to get the NCDs off, or what is the whole vision for the NCDs we have?
See, I mean, I'm working on a very small geography.
Mhm.
Yeah, I just want to try to create an impact, try to create a niche story that digital health is helping the especially tackle the NCD problems at the last mile at the grassroots village level, where we set up these kind of clinics to kind of ensure that there's an early diagnosis of any kind of a medical emergency problems which can be missed at times.
Right.
So try to build upon that mission of digital e-clinics using cloud solutions, IoT, using various kind of wearable devices, etc.
Right.
So that early the diagnosis of a NCD, like a life-threatening NCDs like cardiac ailment or a heart attack, can easily be diagnosed and proper advisory can be given at the right time, so that proper medication, simple basic medication can be can be advised, and then we can at least try to save a few lives with this digital approach. And for me, yes, for the last 3-4 years we've been doing this, and I have a track record of more than about 1 lakh of patients that we have seen, and we have few amazing stories of how this has really equated into life saving hours, and we could really do wonders in for the patient as well as bring in more smiles to their families, because India is a very diverse, complex country,
Right.
where we still value the Hindu family
Right.
culture, and we still believe that a knit family is very essential.
Right.
Since there was a use case that I lost my own brother, in a heart problem where we were not able to diagnose a heart ailment, and it was a delayed diagnosis. So whenever there is a bread earner in a family who dies, the family is affected, and it might take generations for them to kind of come back to normal life. So I felt, let us focus on one geography, let us see few districts and few villages to see how best we can impact as many lives as possible. So far, I mean, so good. I mean, I have more than about 1,000 patients who really in a golden hours we could save them.
Okay.
So I have their entire data and their histories and their entire early diagnosis to the diagnosis stage to the interventional stage. That kind of story has been built up, and I'm passionate about that. This is doing something good, and I aim to make more of this ecosystem.
Right.
Using this
So
approach.
that's a very good goal you have, first of all. Second of all, being a doctor, you look quite tech friendly to me, right? But most of the doctors in India are not tech friendly. When I talk about adoption of technology in hospitals, in healthcare,
Yes.
doctors are the last last people to adopt a particular technology, right?
See, I mean, I'll just change your, rephrase your sentence. I mean, see, doctors, yes, they are, nowadays you see most of the doctors use, high-tech smartphones.
Right.
They are too aware of their own health.
Right.
They wear wearables. They educate people. So it is not that doctors are not too tech savvy. They
Right.
learn about it, everything, and doctors are always eager to learn new things and implement that in their practice.
Right.
It is just that the entire collaborative approach, right from the medtech companies to the tech team which the doctor or the hospital has, and to the mission which the healthcare hospital leader has in implementing this IT tech or medtech innovations to the medical thing, has to be focused.
Right.
And the most important part nowadays is on investments,
Right.
because no tech comes at an easy cost.
Right.
I
Right.
mean,
Of
it is
course not.
expensive. So healthcare providers, especially corporates, and should invest in health, tech, digital health, and kind of uprise themselves, because the world is going towards it.
Right.
And if we don't do it now, we'll be far behind.
Right.
So yes, the country is moving ahead. I mean, there's good leadership from the top. It is just that we need to collaborate in a win-win situation, so that the medtech companies are benefited. There's proper data getting stored, intervened, interpreted,
Right.
and kind of impact is being created and intervention done.
Right.
So this connecting all the dots is important. And coming back, yes, hospitals are now definitely adopting this digital approach. In COVID time, most of the hospitals did use a lot of applications.
Right.
But it is just that we need to have a right framework of digital rules and regulations to kind of get this going. Well, we are in the process of going ahead. So it's just a matter of time.
So since we are in the process of evolution itself, I was talking to Dr. R.K. Srivastava here a while ago, and we were talking on EMR, the adoption of EMR in hospitals, which is also a quite expensive technology nowadays, right? But if you see in USA, EMR is essential to run a hospital, right? So what do you think about EMR being strengthened in India, blockchain in India? Like blockchain could keep patient records secure.
Yeah, see, blockchain is a very too advanced, subject,
Right.
Especially coming to healthcare.
Right.
So I was part of this India blockchain conclave just last week,
Uh-huh.
where I had the immense pleasure of meeting many tech guys who are into the space, and me sharing my vision of blockchain getting into healthcare, where I might do a pilot very shortly. Well, I mean, we can't compare our ecosystem like the US one. See, our ecosystem is much more. Again, it's starts with the basic trust of a patient and a doctor.
Right.
So our core principles that even the lower middle class people, they trust the doctor.
Right. Of course.
They don't even look into what the doctor is writing, what the doctor is, what the paperwork is about.
Right.
Yes, the doctor says, yes, you're going to be fine. Take these medicines.
Right.
So that trust is a phenomenal boost for us. And that's why India is doing so good, has done so good in this pandemic. Again, coming back, yes, there is an adoption of electronic health records, which is upcoming, but it's going to take a long time. It's going to, and the whole sole purpose of getting the medical records and an e-form has to be defined. I mean,
Right.
I mean, there are thousands of images in the CT scan, the X-ray, the lab reports. So when the proper usage of this data has to be defined.
Right.
And who are the end consumers or beneficiaries going to use this data?
Right.
Yes, insurance companies are there, but it is developing. It will take some time.
And what do you think about technology? Like, will technology stop the medical malpractice? Because I'll tell you, sir, very frankly, I went to a hospital last week, and I went along with my mom. She was with some ailment, and the doctor the doctor wrote unlimited number of medicines on the page. I was just reading them, and it was just pain in the ear and nothing else. So I couldn't even recognize all the medicines that was on the page, but I totally thought it was a medical malpractice just to get some money out of us. I'm not sure whether it happens in every hospital or not, but will technology be sustaining it somewhere? Will technology be stopping it somewhere?
Well, see, it's a question of debate.
Right.
I mean, see, there are two things which you have just said. One is on the malpractice,
Right.
and one is on the technology. Reducing the malpractice.
Right.
See, the malpractice, as such, the word is disheartening.
Right, of course.
Yeah, and I'm sure. I mean, if you would have gone through a bad phase, no hard feelings. But I feel we doctors generally don't. We are having some huge ethics within ourselves.
Right.
That most of the doctors whom I've met, I mean, in my life, I mean, I don't see anybody really going ahead and trying to do some adverse getting some adverse benefits. But yes, I mean few odd instances I can't deny,
Right.
I can't accept, but okay. So this is, yes, technology will rationale certain like early diagnosis, AI tools can give the doctor some differential diagnosis.
Right.
Like if I'm checking volumes of more than 100 patients or 200 patients in cardiac every day, so AI can help me in that.
Right, of course.
So yes, there can be a faint chance that there can be some misdiagnosis can be certain diagnosis can be missed out or because of huge volumes or because every doctor goes through some. See, doctor is human being. I mean,
Right, of course.
He also has his family.
Right.
He goes through his own set of personal stress,
Mhm.
and it is not that we doctors intentionally do something weird for the patient. No, we
Mhm,
don't.
mhm.
We don't. I mean, that's why we take up this oath of the Hippocratic oath. No, but ठीक है. I mean, yes, technology. Depending on what we are looking at, especially on the diagnosis front. I mean, digital health, digital tools can help the doctor in coming to a diagnosis, especially in a in a rural area,
Right, of
in a
course.
tier 3 city where the doctor is not that exposed to kind of larger complex problems. So
Mhm.
it will definitely help, and it has been helping. I mean, it has helped me. So definitely it will, I'm sure because I'm using this tech to get some diagnosis for me where I'm not available.
Mhm.
So I mean, I see this will definitely uh, enhance the patient experience,
Mhm.
and then doctor will definitely take it as a a given tool
Mhm.
for him to deliver more his skills and acumen more towards the patient.
Right, right.
That's how these applications and digital tools have been
Right.
made custom made to.
Right, right. I also read about a few startups that were happening in the rural areas to benefit the people of tier one or tier two cities. Right. So, sir, just the last question, the last basically advisory which I would like to ask you is, can you tell our audience something about stress management, like how they can keep their heart healthy? Is there anything, any mantra of keeping their heart healthy?
See, that's a philosophy question. I mean, live life. See, no matter what stress comes in, everybody has stress.
Right.
So try to cope up with the stress. Every
Mm.
human being has has all kind of stress in their life.
Right.
But just try to let go. Let go. Whatever is financial problems, the family problems. Let go. Time is the best healer. We run behind certain materialistic or certain emotions which can destroy our present.
Right.
So rather, just let go. Things will fall in place. And end of the day, God has given only one heart.
Right.
If I buy a car, if my engine fails, I replace it with a new engine.
Right.
But if a heart fails, I can't.
Yeah, of course.
So likewise with other parts of the body. So it's a God gifted life. So let go is the only mantra for me rather. I mean, this has helped me a lot. So stress, yes. I mean, different people have their own way of
Coping up
de-stressing
with stress,
themselves.
yeah.
But end of the day, just give more time to yourself and your mind, and let go whatever is bothering you.
So, guys, as you heard, letting go is the mantra of today. And Dr. Amit Raj, he shared quite a good piece of knowledge with us. Like each and every aspect which I could cover with him, I have covered today. We are in a shorter time right now, and we'll see off a session. So, thank you, Dr. Amit, for being
Thanks,
with us,
thanks.
and
Really appreciate it. Yeah.
thanks for this. Thank you, sir.
Thanks, man.
Stay healthy. Thank
Stay
you.
healthy.